Hi guys, so my name is Kylie Edwardson and I am doing this oral presentation for my ethics class. Just basically talking about ethics and what we know so far and important features. So ethics is the code or morals people follow that guide them in how they live and the decisions that they make. There are three different areas of ethics. There's normative ethics, which is a study of principles, rules, or theories that guide our actions and judgments. There's meta-ethics, which is a study of meaning and logical structure of moral beliefs. So this is basically just taking a step back and looking at the deeper meanings such as why, or is this decision, was it good or bad, and things like that. And the last one being applied ethics. And this is the study that results from applying ethics in a specific circumstance. So basically you use ethic principles in a situation, and then you're studying the results from that circumstance. There's four really important features of ethics. The first one being the preeminence of reasoning. In this stage of ethics, you're basically analyzing how you feel and what you know about the topic before going into it. We're analyzing an argument to make sure it has solid evidence or premises to back up statements and come to a logical conclusion. It's very dangerous to believe claims without having proper evidence, so it's important, this stage is really important to make sure that you understand and you know that something's true and you have the proper evidence before proceeding. The second important feature of is universal perspective. And this is when a principle, rule, or judgment applies in one situation, it must apply in all other similar situations. So when something is right or wrong for one person in a situation, then another person being in that same place will have the same right and wrong standards as the first person. Another important element is the principle of impartiality, and this is where all persons are considered equal and should be treated as such. So it doesn't matter the situation, the race, the ethnicity, everyone is treated the same and has the same moral rules. And stealing is a big example of this. It's not okay for anyone to steal at any time. It's the principle of impartiality. The last important element of ethics is the dominance of moral norms. And this is basically when a moral norm will override any other kind of norm such as legal, aesthetic, or prudential, and it's justifying that the moral norm is more important than the legal or other kinds in a certain situation. So for my profession, I'm going to school right now to be a nurse. I haven't decided exactly what field I want to be in, but I'm leaning towards labor and delivery or neonatal care. Understanding and applying ethics in my career is a huge deal because almost every decision you're making in the healthcare will go back to ethics. Is it okay for this? Is it good or is it bad? Making things heard too for the patient. So some of the things that I'll be experiencing as far as ethics goes in my career, one being making sure the family has all the information before doing any kind of procedure. It's important that they know what they're getting into, the goods, the bads of the surgery or whatever's happening, to make sure they know and they're knowledgeable on their decision so they can make one that's appropriate for their family. Another one is not speaking up when fellow coworkers or nurse neglect their responsibilities. This can be a hard one, especially if you're close with the other nurse. You don't want to go tattletale on them. But it's important that you do report any neglect and responsibilities because we're taking care of people's lives. And another one is making sure the patient's voice is heard. Even if I don't agree with their decision or what they want to do with their medical care, it's always important for the patient to have their say in what's happening, no matter how I feel about it. Moving higher up in the healthcare system, things that ethical decisions that doctors or surgeons have to take care of. One of them being placing limited medication or organ donations. This can be a hard decision because the people on the waiting list, they've all been there a long time and they all believe that they need it. So that's a hard decision to know where to place the donations. Another ethical decision or dilemma is physician-assisted suicide. Some doctors think it's not right, others think that maybe they're in a lot of pain and maybe they do need the physician-assisted suicide, and so it all depends on the doctor and what they think is ethically okay. And another huge debate is abortion. It's all over the news, it's all over, everyone's talking about it, but abortion is a big ethical decision on whether they believe the baby is a person or they believe that maybe the mother is sick and she can't deliver the baby. So those are some of the bigger ones. Knowing about ethics will help me to make good decisions fast. In the healthcare system, everything is moving so quickly. You don't have time to sit back and judge the pros and cons, so having that solid foundation in ethics and knowing what's right and what's wrong before can help me to make the correct decisions quickly and in a good way. Ethics will also help me provide the best and safest care to my patients, whether it's reporting something I notice be wrong or making decisions in general in the first place. Overall, I think ethics is very important to have a solid understanding of because it's used in every decision we make on a daily basis in our jobs, in school, with our friends. I've had many times when I have to make decisions and I have to think back to what's going to be best and what's wrong and what's right. But overall, I think ethics is very important for everyone to understand. So thanks for watching.